Welcome to Grand Rounds. Today's September 28th, and I wanted to start off by just highlighting the additional posts you'll see for our Women in Medicine Month. This is our last week of the month, and we're celebrating with a newsletter post, not only from our Diversity Corner with Dr. Caceres and Dr. Dunn posting that article, as well as Dr. Kanisha Desai speaking about her journey with quality improvement and as a clinician educator here. And that is in the newsletter that just came out yesterday for the department. You'll see on your screen some other features from this week, as well as social media highlights. And so I encourage you to take a look. Our next announcement is for our inclusion rounds coming up on October 3rd. If you have the next slide, please. That's going to be October 3rd. It is going to be on disability panel moderated by Dr. Holly Tabor. And that will be a virtual event, and there will also be closed captioning. Following that, our next event that I wanted to highlight is, the next slide, please. Yes, is the Ballet Folklorico, which will be taking place on October 11th. Followed, and that's a live performance here. And I don't believe actually registration is required. And then after that will be a panel on LGBTQ health moderated by Dr. Wendy Caceres to celebrate National Coming Out Day. Get the next slide, please. We have an additional installment of our 1619 podcast discussion series moderated by Dr. Nhma Dunn and Dr. Argavan Salas, which will be taking place, I'm blocking the slides, coming up later this month as well. And lastly, next slide, please. Our upcoming grand rounds will be Dr. Andrew Elder, and it will actually be here in this same place in person, LK 120. And Dr. Elder will be speaking on Frail America, Life in the Fourth Age. And so that will be our next speaker, again, in person or hybrid, if you will, in the same format. And let's see, okay. And in a moment, we'll be getting started. Our speaker today is Dr. Elena Rios. I am very fortunate to be introducing her today. I think Dr. Caceres was going to be joining us as well. I just wanted to pause for a moment. Dr. Wendy Caceres, our Associate Chair for Diversity, will be introducing our very esteemed speaker today, Dr. Elena Rios.
Good morning, everyone. Best laid plans of mice and men always are disrupted by bridges. But here we are, so good morning, everyone. Welcome to Medicine Grand Rounds. So I will have the distinct pleasure to introduce Dr. Elena Rios, one of my heroes. Dr. Rios earned her bachelor's right here at Stanford in human biology and public administration. She's an active alumni here. Was not that recently, but was appointed to the Minority Alumni Hall of Fame at Stanford. She obtained both her Master's of Science in Public Health and MD at UCLA in their schools of public health and medicine, respectively. She completed internal medicine residency down the street here at Santa Clara Valley Medical Center and also at the White Memorial Medical Center in East Los Angeles, and followed that with completing her NRSA Primary Care Research Fellowship at the UCLA Division of General Internal Medicine. He is currently the president and CEO of the National Hispanic Medical Association, NHMA, which represents 50,000 Hispanic physicians in the United States. The mission of this organization is to improve the health of Hispanics. Dr. Rios also serves as the president of NHMA's National Hispanic Health Foundation to direct educational and research activities. Her prior roles are numerous, but to highlight just a few, she has worked with the HHS on women's health as executive director of Hispanic Serving Health Profession Schools, was appointed to the National Healthcare Reform Task Force as coordinator of research outreach groups for the White House, and for the state of California Office of Statewide Health Planning and Development Researching Policy. She is one of the most recognizable national leaders in Hispanic, Latinx health and policy, both in California and in DC. And she serves or has served on several boards and committees for the NIH, the US Department of Health and Human Services, ACGME, and the VA National Academic Affiliations Council, to name just a few. She lectures and publishes on the health of Latinos and has received innumerable leadership awards. Again, I will highlight just a few. She's received accolades from the HHS, the Congressional Black, Hispanic, Asian, and Native American caucuses, the American Public Health Association Latino Caucus, and is recognized as a National Diversity Council top healthcare leader. She's a fellow of the New York Academy of Medicine, of the Institute of Medicine Global Forum for Health Professions Education, and of the American College of Physicians. Welcome, Dr. Rios.
Okay, thank you. It's an honor to be here. Thank you, Wendy. I want to thank Dr. Fernando Mendoza, who's in the audience. Dr. Mendoza is one of my longtime mentors and was my boss at the Hispanic Serving Health Profession Schools when I took over that job after leaving the HHS government for going to the private sector. But anyway, I think that it's been a long road. It's been almost 30 years. Next year will be 30 years that we started in Nhma. The National Hispanic Medical Association was actually started at the White House. The month that the AMA said it was healthcare reform was going to be socialized medicine. 10 organizations were invited by President Clinton and Hillary Clinton and Secretary Shalala to come up on stage with C-SPAN television to be able to say that 10 organizations in the country had more members than the AMA and were supportive of healthcare reform for the most vulnerable in our communities. So anyway, this is the story and some highlights of where we're headed as an organization for the future of Latinos, and especially Latinos in medical education. So we always start with the context, and the context is the Latinos in healthcare disparities in our country. And it's really because of the system that doesn't allow us to have the healthcare quality that we deserve. The lack of health insurance coverage, even despite the ACA, the Affordable Care Act, Latinos still remain the highest ethnic group in the country without insurance for a lot of reasons. And I'm not going to go into all the details, but let me just say that the employers that Latinos work at don't have the money to buy insurance. And a lot of Latinos, of course, don't trust the government, are immigrants, and fearful of deportation, especially with public charge being brought up and changed by the last administration. We also have less access to care because of not having insurance, higher prevalence and less controlled chronic illness, heart disease, diabetes, obesity, you name it. Latinos have a higher prevalence of worse conditions because they lack the preventive information and the access to healthcare. Higher exposure to COVID-19, and that I think came out very strongly in the media, that essential workers, people living with multi-generational housing, people exposed tremendously much more than others were Latinos. Social vulnerability index that now CDC uses and others, California uses this also, to look at zip code levels, shows the extreme poverty, education, lack of education, food deserts, housing problems, transportation problems. The immigration status that we have that includes, being a refugee or being having a green card, but not having the citizenship that U.S. citizenship is an issue. And then, of course, our language, limited English proficiency among our communities, especially the elderly or the immigrants, and health literacy, which is a major issue. So we have limited health, but we also have limited health professionals, whether they're mental health care, primary care, specialties, just across the board. And of course, women's reproductive health is another major issue that has just come up with the eyes of the Roe Act. I think that what's important also to know in this audience is that of all the doctors in the country, only 5% or maybe 6% are Latino doctors. And this has been flatlined since the AAMC started its goal of increasing diversity in this country among medical educators and physicians in 1975. We've been flatlined. And that goes the same for African Americans and the Native Americans in this country. So about our organization, the National Hispanic Medical Association was established in 1994 officially. We actually created the name in 93, as I was saying earlier at the White House. We had come together, and a few doctors from California would come out, New York and Texas, come out to the White House for meetings once a month in 1993. I actually worked in the White House that whole first half of the year. So when we established the organization, we decided to be a 501c6 nonprofit, which is a trade association representing members, and now having the database of over 50,000 Hispanic physicians that are licensed in this country. Of course, there's a lot of other doctors that we work with that are not licensed and looking forward to getting into your residency programs. The mission is to empower Hispanic physicians to improve the health of Hispanics with Hispanic medical societies, Hispanic residents, Hispanic medical students, and all of our public and private partners. We also established our foundation, which originally was called NHMA Foundation, but we changed the name to be more inclusive and called it the National Hispanic Health Foundation, which is the 501c3 arm of NHMA, for research and education. And we also started a different website, HispanicHealth.info, that has English and Spanish information, and also has the websites of all of our National Hispanic Health Professional Leadership Network, which are the Hispanic societies representing professionals, the Hispanic dentists, the nurses, the public health, the pharmacists, mental health, dietitians, social workers, and probably more that I forgot. But that's where you find all of our links to our websites. And what do? We serve as a resource. We really do different things, and we serve to develop leadership, and we serve to develop networking opportunities to advance our careers, to advance the careers from the pre-med all the way to the professor level or dean's level, if you want to, to the highest levels of academic medicine, and also to the highest levels within the healthcare industry, and of course, in public health. How do we do that? With federal government, we partner to develop congressional briefings. We use Congress's educational arm of briefings to educate young staff on what are issues and policy recommendations that we feel they could use to change our healthcare system, change it to eliminate health disparities. We nominate our members to federal advisory committees, especially grant review committees, so that more and more of our doctors could understand how to write successful grants, which are getting harder, as you know, at NIH. Government affairs, we do advocacy. We sign on to a lot of letters with other national organizations. Today is the White House Conference on Hunger, Nutrition, and Health, and we have members at that conference. We've signed on to letters right now with the Congress looking at the last days of the continuing resolution, where you got to have a budget to keep Congress, keep HHS going and other agencies going. We sign on to letters for Medicare, social determinants of health, and other things. For leadership development, our flagship, I'll just say program, is our NHMA Leadership Fellowship for doctors, and I'll go into that a little later. We also have our network that I mentioned, and we mentor at every step of the way. We have doctors mentoring residents, residents mentoring students, and students mentoring pre-meds and pre-public health. And of course, our networking is really our annual conference, where we have many, many speakers from across the country that are not Hispanic or Hispanic, either or, who have experience to share on how to improve our healthcare programs in our communities. And we have chapters, 18 chapters now across the country. So our policy and advocacy for this year, just to highlight a few things, and I mentioned this earlier, go along with what I mentioned, that we really do need to focus on access to insurance. And the biggest insurance company in the country is Medicaid, now accepted by not only public, as a public government program, but also used in private. As you know, it is a program that is federally funded and state funded. And we strongly believe that the federal government needs to increase, especially in Texas, Florida, Puerto Rico, and the territories, where our communities suffer the most because they never got the Medicaid expansion. You know, it's all political. We try to be above politics because we are really focused on the importance of our communities. And but Medicaid expansion would go a long way to helping our communities. The other thing is Medicare Advantage. Medicare Advantage was changed to allow social determinants of health. I don't know how many know, but if you have asthma, you are a Medicare Advantage client or beneficiary, you can have air conditioning put into your homes and get it reimbursed. You can have ramps put in if you're disabled. Also, there are other transportation programs, et cetera. And then reimbursements for providers. We think that reimbursements should include language, should include anything that doctors have to do to have a quality experience for their patients. Be more respectful of the Latino patients means you have the whole family come into your visit, not just one patient. You are able to get reimbursed for a healthcare system that doesn't quite exist. It's moving towards value-based care, but value for us is very unique. COVID-19 pandemic and the emergency situation is all decreasing. It's all unwinding. And there's going to be a lot of people, especially the Medicaid, that's going to be now once a month churning again, as it was before the pandemic. Vaccines and testing will no longer be free. So there's going to be issues with that. Climate justice. This administration, the Biden administration, decided to come up with climate justice as a policy that all funding for climate change would include 40% for our communities, who are always the worst off. The community of Houston, Texas, the communities of Los Angeles with air pollution, the communities of, the Colorado River giving water to all of Arizona and the Southern California. These are huge disasters that are happening. And of course, in California, climate change is, having more, causing more fires, wildfires up here. And then, of course, there's gun violence, the women's health, and diversity in healthcare workforce and clinical trials. So these are just examples of 3 types of campaigns or projects that we have. One is our health communication campaign, all around vaccination. Early on, when COVID started, the Ad Council asked us to be a part of their rollout with Dr. Fauci and the AMA president. And everybody was talking about one individual responsibility. Everybody should get a shot. You should get a shot. Take a shot. All these different, right? So we said, no, for us, it's family. We need to vaccinate for all. So our campaign under the CDC is called Vaccinate for All. We focus on champions that can be individual doctors or other health professionals or organizations. But the main focus has been on media training and placement of our messengers who are professionals, not the stereotypical Hispanics in this country that you see on media. And we've gotten Spanish-speaking doctors to be on on Telemundo, and in getting radio interviews and getting in newspapers. We have community vaccination grants to our chapters in different places, and we are collaborating with national groups like construction companies. For example, Dr. Badia up there is going to be speaking for one of our projects, where they have asked us to provide doctors speaking in Spanish to their workers and their families about vaccination hesitancy and the importance of getting more increased vaccination. Our COVID-19 webinars, we started without funding in April of 2020 because we knew how important it was to get into the Zoom and world and start monthly webinars, and they still continue today. Our health literacy toolkit and lectures and our vaccine disinformation uptake activities have been supported by Johnson & Johnson, Sanofi, and the Rockefeller Foundation. The Rockefeller Foundation gave us funding for Oakland, Chicago, and Houston. And one of our doctors actually developed a nonprofit with bilingual books and videos for the grammar school kids. We sent 50,000 to school districts in those 3 cities. We have them on our website, nhmafoundation.org, and you're welcome to give us any feedback on if they're effective in your families. They're bilingual, English and Spanish, and they're characters, a cartoon character called Kiko. Cardiovascular disease and asthma advocacy has been something we've done with Amgen and with 4 states, meeting with the governor's offices, the Assembly and the Senate Chairman of Health, and talking about the importance of not only how to care for these patients, but how to increase diversity in them, especially with Hispanic doctors and nurses and others. And then the Let's Stop HIV Together has been our longstanding grant with CDC. So those are campaigns. In terms of education, again, I mentioned the Leadership Fellowship, and just to give you a highlight, it's for doctors who are committed to leadership, who have already been in practice or in an academic world for 5 years, who can demonstrate their journey in leadership, to be on committees, to understand how to have meetings, that type of thing. But also to have a 1-year executive development program. We have been funded by CDC now for 2 classes, 20 doctors a year. We started in 1999 with the Clinton administration. We got funded by the Obama administration. And in between, we've gotten funded by private sector. We have over about 150 doctors now that have been trained. Some of them are the New York City Health Commissioner. Some are working at HHS. One of our latest doctors who just got appointed to the California's Surgeon General, Dr. Diana Ramos. These doctors have been very interested, but don't have the network or the guidance on how to get into leadership within public health, especially. So we're very excited about that program. We have an academic career development program with NIDDK. They pay for up to 35 junior faculty and last year residents to come to our annual conference. If you know anyone that is of interest, who has research experience and who is Latino or Hispanic, we bring them, again, paid by NIH. The Hispanic Leadership Development Fellowship is a new program, and this is the first OMH-funded program to find Hispanic, I'm going to say, experts for HHS. These are master's level students who have graduated from their master's in public health or social work, and we are putting them in HHS offices, and we have the whole Hispanic Employee Association providing, working as mentors for the other education program that we are starting, and we have started it this last year with our conference. That was the first conference that came together in person in Washington, D.C. A leadership summit to develop the importance of NHMA as an organization to expand collaboration. As Fernando said, a collaborative impact with medical schools. Not only medical schools at pre-med to medical school level, which we've done for years, but leadership and faculty and graduate medical education. And the recommendations to increase NHMA partnership have come from the AMA, the ACGME, the AAMC, and medical schools in our chapter areas. We want to focus. We have a Northern California chapter. We'd like to focus here at Stanford, UC San Francisco, UC Davis. We have a chapter in Southern California with UCLA and USC and UC Riverside, UC Irvine, and the Drew Medical Schools. All of these schools have the interest of ours to be able to collaborate and find more Latinos for different levels of education. Because they're in our network and we're national, we can bring people to these different. And at any rate, this is an example of a visiting lecture that is very important to expose you to what we do. In terms of our activities that we already have ongoing, and this has been going on for years, the Office of Minority Health has funded us for 5 years for our College Health Scholars Program. We have actually reached 2,000 students in the country, focused in California and Texas, where the most Hispanic college students are that go to the medical schools of this country. And we've focused on financial assistance, information, academic resources, as well as professional development. Saying no to your family, that you can't visit them every Sunday for dinner, being able to explain to your significant other that you have to stay in the library till 11 o'clock at night. These are things that our students who are first generation don't understand, have never understood what is the discipline needed to pass an MCAT with highest scores and to have the best trajectory of science GPAs from freshman to senior year. So those are the things that we teach them. Mentoring. And we found that the pre-med students would like to be mentored by medical students. not the old doctors like us that don't relate to them anymore because we're their parents' age or their grandparents' age. So we've learned a lot, but we've actually shown that, and this was a research study for the Office of Minority Health, we showed that mentoring significantly made a difference compared to the control group that did not get mentoring. And we're going to continue this program and mentor all that we can bring together, but for a year instead of 5 years. Council of Residents that we have, the NHMA Council of Residents, has webinars on how to get into residency in general. But we decided, well, we need to start more specialty councils. So we now have the NHMA Council, our specialty, to help find doctors who can help, who are on admissions committees, who know how they grade applications, to talk to the medical students of the country, the Latino medical students, to tell them that, how to get into residencies, to encourage them to apply for different specialties. And then we have our scholarships. We now have 40 scholarships a year, pretty much, because we have scholarships that are given to us. United Healthcare Foundation is our major sponsor. Next year, they will start with $20,000 scholarships, $5,000 a year for 4 years. And we're fortunate enough to be the only Latino organization in the country getting these scholarships. The other groups had them, but they couldn't find the students. The Center for Hispanic Health Research is something that we have started with our foundation. And the idea is that we should look at clinical trial diversity. Clinical trial from doctors that are in academic as well as in private sector. And the big push, because the President Obama's last law that was signed in 2016, after President Trump became president, before he became inaugurated, President Obama had his 21st Century Cures Act that not only created the moonshot for cancer, but created a mandate for FDA to have clinical trials actually be diverse. Well, investigators as well as the participants. The only way we're going to do that is by partnering with pharma. So we're partnering with the Pharma Equitable Breakthroughs in Medicine Development. I'm actually on the executive committee now, and this was funding given to Yale, Morehouse, and Vanderbilt. Johnson & Johnson, Merck, Lilly, Genentech, more are working with us already. And of course, we have the NIH program, and we are a partner with the All of Us Research Program, which is the precision medicine program for NIH. A million Americans together over 10 years and follow them with open access data, including genomics. And then we have our databases, and we are developing a mentoring program because we just thought, the easiest way to increase the numbers is by having mentoring, so that the person who went through the journey of developing their clinical trials and their medical practice can provide information to the young doctors or residents. We want to use residents as the mentees who don't know what they're doing yet, who might be interested in getting into clinical research with either academic faculty or with junior. And in our councils and chapters, and I'm almost done here, this is really just to show you that we have these Council of Anesthesiology, Dermatology, Cardiology, Clinical Research, Emergency Medicine, Family Medicine, Internal Medicine, Pediatrics, Public Health, Surgery, and Plastic Surgery. They're all in some of them met this year for the first time at our national conference, and we'll be meeting once a year at our conference, so that those who come to the conference can join in on meeting and networking with different specialties. And hopefully in the future, as other organizations do, we've been mainly a topical, topic-focused conference, women's health, children's health, things that are important to Latino health, where all different types of doctors can come together. We'd like to specialize and have the plastic surgeons talk about diversity within plastic surgery, or topics that will have increased quality care for the doctors within that field. That'll be the future. And we'd like to have our chapters that are now in 6 different regions and increase their activity with the medical schools in their region. And lastly, our 26th annual conference will be in Chicago. We're taking it out of Washington, D.C. because we decided we have to build the networking in different parts of the country. We came to Los Angeles, we came to San Antonio, and we went to New York City, but we've never come to Chicago. April 27th through the 30th, we're going to bring our fellows alumni together and have plenary sessions that are focused on medical education with Medical Chicago, women's health, climate justice, medical partners, and our fellows policy presentations. And it's all CME. And these are just some pictures. This is Dr. David Hayes Bautista, who just joined our board of directors in the middle there. And on his left is, on his right is Diana Ramos, who's our new Surgeon General for California. She comes from USC. Also been working in the public health department and part-time with Kaiser as an OBGYN. On his left is one of our board members for the NHHF, Conchita Paz. This is just to show you our conference. What we do, we take our doctors to Capitol Hill and visit Congress offices and Senate offices. Here's a few of us here from California talking about the importance of our college health scholars program. And this is our scholarship students. We have two different galas, one in Los Angeles, one in New York City, LA last November. And of course, our mariachis entertaining the group. Senator Padilla couldn't make it. He gave us a video, but we know Senator Padilla from California. A couple of our awardees, Dr. Byington, who's the first Hispanic University of California vice president in charge of the medical schools of the UC system. Dr. Tony Alamo, who's from Nevada. Our board of directors, executive director there on the far right. And this is our contact, so I'll just stop here, but we do have two different websites. Our NHMA is the nhmamd.org with all those programs that I mentioned, activities, and then our foundation website. And again, our scholarships are open to graduate students in medicine, dentistry, nursing, public health, pharmacy, and PAs. And they give them to those who are outstanding students. They are selected by the organizations that they correspond to. So the Hispanic Nurses Association selects the nurses. We give them the database. They give us the time to review and bring all the students and the parents to our galas. And we invite you to think about letting your colleagues know about our activities. Very much.
Thank you so much, Dr. Rios, for that talk. So I will help moderate the questions. So first one, we have one back here from Dr. Padilla.
Oh, perfect. Thank you, Dr. Rios, for a great, can you guys hear me okay? Thank you for a great presentation. So my question sort of centers around Latino physician representation. So given that in California, it's expected that about 50% of the population is going to be of Latina descent by the year 2050, we're currently at like 39%. What are things that medical schools can do now in your sort of expertise to increase the representation to sort of meet the cultural and linguistic demands, for example, of our patient population? And I see this every day. I work on labor and delivery as an obstetric anesthesiologist, and I'm speaking Spanish every day. And sometimes it's frustrating because I'm like the only Spanish-speaking physician in my division. And so it's like, what's the sense, how do we translate that urgency to the medical school leadership to say, hey, we need solutions now because it's already here, these, our patient or Latino demographics. So what are things that we can do to sort of meet the demands of our communities? Thank you.
Well, I think let me give you two examples. When I was in the Office on Women's Health, we did a first cultural competence conference for the country with the Office of Minority Health, and that was in 1995. We did a survey of medical education for curriculum on cultural competence, and hardly anybody knew what it was. Last year, the last 2 years, I've been on the committee for the ACG to look at awards for residency programs in this country based on diversity, because the ACGME changed their guidelines maybe 3 or 4 years ago. And I've been amazed at the only medical schools that apply, right, for awards or for the curriculum are the few medical schools that are ahead of the curve who have leadership within those medical schools to know what to do, to answer the call for action that we should change our curriculum or change our systems of teaching to include Latino issues. So for example, the ACGME programs, the awards were given for residency programs that actually taught in communities, that actually took residents to different families or to different places where the churches, the supermarkets, and try to include curriculum time to be able to have visits like that. And then to talk about it and to have some type of, formal presentation. The Council of Medical Specialties, and I'm getting it wrong, they asked me to be on a committee just this year where they did the same thing. They're giving awards for incentives to our medical education system at different levels to change and to be more, I'll say more respectful, but it's really about being more inclusive. And I do think it comes from those schools or programs that have the leadership that understand the country's changes. To be able to have a better, better healthcare for everybody means that we have to have quality care for everybody. And you can't do that if you don't have Hispanic doctors or Black doctors or, doctors that look like our communities. So anyways, I hope I answered your question, but I do think it takes leadership and it takes planning, and it does take actual, actually doing the work to get the awards and to be, and we probably need to showcase more how important it is to the rest of the medical education. People can see those early adopters that are going to disrupt this whole system eventually.
Very true. Speaking of younger generations, so here at Stanford are many of our leaders in DEI work and in recognizing the change in the population have been our pediatricians, because they are already a minority majority. So you already know Dr. Fernando Mendoza, who's here, and Dr. Bonnie Maldonado. So we in the other departments have really learned a lot from pediatricians. And it's only a matter of time, as you said before, we are minority majority in our patient population. It'll be within our lifetimes. So we noticed your list. One of the questions in the chat is we noticed your list of the different specialties that are now councils at NHMA. Is there going to be plans for other specialties to be added? I think someone mentioned in the chat about pulmonary medicine because of the high prevalence of asthma, Hispanics, and probably also long COVID, which is probably under recognized in Latino communities at this time.
No, we welcome any specialty. We have an agreement to have 2 leaders. It's always important to have a leader and an alternate when they can't make it. 2 leaders and 5 members to start the councils. And if anyone's interested in having a council to meet at our next conference, which will be next April, be happy to have you go to our email. And I don't think, well, my email's there, Rios, but the nhma@nhmamd.org is our executive assistants and organizational assistants email. Happy to work with anyone for NHMA. We're also looking forward to having the collaboration with the American Academy of Pediatrics to help us with the Pediatric Council, that type of thing. We also nominate our doctors to the mainstream organizations, advisory committees. And it's a way to, again, to build those relationships.
And then I'm wondering, in terms of, you mentioned that there, something you mentioned I wanted to dive into a little more in terms of research agendas for Latino community. Where do you think, folks at Stanford could focus?
Well, Stanford is a premier research institution. And I think that with Dr. Mendoza's guidance, Dr. Maldonado, who I went to high school with, their guidance, and others here, especially you, Wendy, and the Department of Medicine, we'd be happy to, have a meeting and discuss. We're getting support for the staffing to develop a mentoring program, and we want to do something specific so that we can build those databases. We actually have a database now of all principal investigators for pharma who are Hispanic or who identify themselves as Hispanic. Of course, we'll use that too, but I think whatever we can do at Stanford that would help us and help Stanford would be of immense great.
Question from Dr. Mendoza.
Thank you. I first want to say, you are leaving a legacy that is going to impact the future of this country. And very proud of being your colleague on that. At the same time, you spoke about the issue of how flat things are in terms of medical students. I became a faculty here in 1981, and the population equity, number of graduate from medical school to the population, at that point was 45%. When I retired 40 years later, it was 35%, because the population had increased and the numbers of medical students had not. And that was really a concern, right, for all of us. What do we do differently? And I think it's not just a concern about numbers, it's about the loss of the human capital that we have in this country that's not being, used. In a final analysis, as one looks back over the last 40 years, we all do great work, but we do it separately. And indeed, you've shown the ability to bring together physicians from the community, the Hispanic community, Congress, state legislatures. And I'm wondering, what's your thought about how we can all work together, medical schools, because something different has to be done. We can't continue on the same path because the same outcome will continue. And I don't think this nation can really bear that. So what's your thought about that?
I think it has to be something that gives a big splash so that everybody sees it. And we talked about this earlier. Maybe it's a report card on medical schools like the US News and World Report does for hospitals. The Robert Wood Johnson Foundation gave a huge amount of publicity and funding to AARP and to others about nursing, that the future of nursing needed to be supported with congressional briefings. And I was invited to be part of this beginning part of it, but then the Hispanic nurses said, no, they wanted to do it. I said, no, that's fine, you guys take it over, be the Hispanic voice. But something like that, I think the future of medicine in this country, it has to be physicians that are from our communities. And like you said, I don't know, well, we all know we'll never reach the population parity that the AAMC set as the goal in 1975, which at that time was 12% minority. And the AAMC is only recognized in 1975 Mexican American, mainland Puerto Rican, and African Americans as the only underrepresented groups in this country. Now the whole census has changed. I don't know if you know, the minorities in this country are going to be North Africans and Middle Easterns, in addition to the Hispanic and the Black and the Native American and some Asian groups. Here we are, Hispanics are going to be we're going to be 50% of the population. So I do think there has to be a awakening of everyone, corporate sector, as well as, so private sector, as well as government and public sector. The state governments that have the most populations like California, I think need to step up too. And I know that they have. Governor Newsom gave a lot of money for the new program for California medicine, is it called? But I think the medical school leadership needs to become more committed and showcase what they're doing in a positive way, not trying to hide that, well, we only have, a few applicants or we can't find them. I mean, that's the typical answer for people that don't really know what to do about it. And I think we all know what to do about it. It's to raise our students to have mentoring at the lower levels of education to bring them up to the standards to get into medical school, which is to have the best science grades and to have the best MCAT scores and all work together. So it's not just medical school problem, it's our society's problem.
Thank you so much, Dr. Rios, for all the incredible work that you've been doing for decades to try to help really the whole country. I have a question about the mentorship program that you mentioned, only because a lot of data on mentorship programs in other contexts shows that they're generally ineffective. And I'm so impressed that your program has been effective. So I'm curious if you can share some of the details of, how that program was structured and why you think it was able to have the impact that it did.
Well, we used mentoring. First of all, we used virtual mentoring. We actually have a platform of great minds in STEM called MentorNet, which was the back end for NIH's National Research Mentoring Program. So we went to that company. We asked them to design a platform for our students. And it was a very simple up and down evaluation, but we had prompts based on the first year of college, second, third, and fourth year. Now, not all students go to college in 4 years, but we had prompts for discussion that would be based on where you were in your year. So a third year junior would be thinking about the MCAT. The fourth year would be thinking about residency. We designed and developed all the wording. The company put together the prompts. So it was flashy, social media type, engaging the students. The students are pre-med students, or they had to show their curriculum. We had to follow grades. And then we also developed a personal mentoring program. The personal mentoring program was a one-on-one with someone like you, female, male, where did you go to college? Did you go to a community college? What area of the country? So that we were hoping they could have in-person meetings. Of course, COVID hit, so that got shot, but we were able to have personal contact once a month, especially phone calls and communication. And then we developed webinars. The webinar series were quarterly. And then we had an online community just for the intervention group, so that there was peer-to-peer counseling. And that counseling was based on topics that we would give once a month. And maybe there would, just like any thread in an email, you get some people saying, well, I need to tell you about how I studied for organic chemistry, or not organic chemistry, but that's an example. But organic chemistry, and this is the review books that I used, or what have you. And so that the students that were contemporary could teach each other. So those were all the mentoring techniques that we used. Probably a little bit more than others. I don't have the data right here. I'm actually presenting next week at the DoM National Conference. But it is, for us, it was very evident that the majority of the Latino students that we found in California and Texas especially are first generation that don't have any access to. And if they have a club, a pre-med club, they hear things at a high level, but don't know the details and don't have anybody to ask. And so tremendous opportunity to have somebody ahead of you who's another Latino student who maybe came from Fresno, California, and just happens to be from the same neighborhood. So that's what we've done, is put together people that are very interested in opening up and asking questions because they trust the mentor. I think for us, that's a really big deal.
Yes, Dr. Lorenzo.
Gracias, doctora. So it's really incredible to see how much you've done in 30 years, like how many programs and how many agencies and partnerships you've been able to establish. So kudos to you and your legacy. You mentioned some of the intractable problems that your organization is tackling. You mentioned access to women's health after the overturning of Roe v. Wade. You mentioned, which I was very glad to hear as a California citizen, to the effect of climate change in the Southwest. Wondering, we've seen this now for several years, and I think reports is that this problem is going to get worse, the problem of human displacement and migrants coming into this country looking for opportunities. And I think there's maybe an opportunity. It's not hard to make a connection between health and human displacement. I wonder what is a position, or what do you advocate for us to do, Latinos in leadership position, maybe NHMA itself, what can we do to advocate for a better way as a country to deal? Because honestly, some of the stuff that I've seen in the last week of migrants being shipped to other states, it's just been really inhumane. And I feel maybe there's an obligation for physicians to speak up on how this country is managing this problem. What are your thoughts on that?
Definitely. I think, well, first of all, let me just answer that we all know that it's politics that drive a lot of media, right, in our country, especially nowadays with 24/7 cable news. And that's a lot of what's been happening in the news, right? Midterm election, the Republicans really want to take over. Anyway, as a non-political organization and nonprofits, we're very concerned about the humanity story, as you mentioned. And we think we really do need immigration reform in this country. There hasn't been immigration reform since President Reagan. And a lot of people became citizens, their rights as citizens. So I think that we do need immigration reform to have more citizens in this country on a fast track. And I've talked to immigration lawyers, and they all say the same thing. The problem is the law. It takes 20 years or 10, 20 years for people to become citizens in this country. So that's one thing. The policies should be really reformed with Republican and Democrat coming together and change better. But on the short term, with physicians and how we can be of service, the Catholic Charities and other organizations along the border, Sister Pimentel, who we honored a few years ago in our conference, there are doctors doing things along the border, but they have to do it volunteer with organizations like the Catholic Charities or other nonprofits that set up the clinics, because you can't become a federal licensed physician overnight. So even that, to be able to help out, that has to be reformed, the qualification process or the certification process. And in terms of national policies, we have Secretary Becerra, HHS Secretary Becerra, and I think that, and then President Biden's Julie Rodriguez, who's the granddaughter of Cesar Chavez, is the head of the Domestic Policy Council in the White House right now. So there are, it's a good timing to have the effort coming from the healthcare leadership world. Great thing to do, and I do whatever we can to help. And we do have an alliance of multicultural physicians that we just started this last year with the Asian doctors and the Native American doctors, because we've been so represented in all kinds of programs and activities in Washington, D.C. So that might be another way to bring collective impact. But I think that it's important to underscore the importance of physician leadership in this country.
We'll wrap up. Great, thank you. We'll wrap up with a question from our colleague, Dr. Arturo Molina. He would like to know if you could elaborate on NHMA's activities and partnerships in the area of clinical trials. He underscored what you did in the presentation about how racial and ethnic minorities continue to be underrepresented in the clinical trials. And he says there's a proposed solution to include the number of minority clinical investigators, but what else is NHMA looking into?
Well, the programs that I mentioned, the program from Pharma with, and Arturo, I thank you very much for listening in. For the Pharma initiative, that is, I think it's a 3-year initiative or so. The Bristol Myers Squibb has another initiative, and there's several initiatives that are being started because FDA has demanded or has required diversity in clinical trials. So the pharma world is developing the training programs, and they're asking us to recruit. Rather than just recruit, we would like to, since we're going to be finding doctors interested, finding residents interested in learning about clinical trials or clinical research careers, we already have databases of residents that have been part of our conference. We want to build the mentoring connection with the doctors who are in research. So it's not just numbers, it's actual mentoring and recruitment for these opportunities that are opening up right now in this country for more research. I think the other thing would be working more closely with NIH to NIH's programs under Eliseo Perez-Table, who's the director of the National Institute of Minority Health and Health Disparities, has changed their focus from just research, but to health disparities research or health equity research, to look at communities and increasing community and coalition participation, to increase awareness of the importance of trusting research. So it's a good timing right now to help these different entities by based on our networks to find those interested in research.
I said that was the last question, but I have one quick one more. So I'm proud to say we've sent a resident or fellow for the last 3 or 4 years to that conference, the NIH and Nhma. So I guess they're in your database. That's great. And I think Dr. Molina put a clarification. He said he would like to know more about, I'll paraphrase it to how can Stanford partner with NHMA to increase representation?
Well, like I said, we have a medical education program. We have had institutional memberships. We'd like to change that, and I'm here today to meet with faculty all day to ask ideas on how we can improve upon the value needed for a medical school to join NHMA. We're not a medical school, but we would like to help the medical schools of this country. So I definitely want to work with Stanford. I come from Stanford family, and it's always been a special place in my heart. And I think that Stanford should take the opportunity to think about how we can help build a more engaging, I'll call it institutional relationship or organizational relationship. We could call a membership of NHMA. Like we have these specialty councils, there's no reason why we can't have a relationship with medical schools.
Thank you so much. You're right on time.
The preceding program is copyrighted by the Board of Trustees of the Leland Stanford Junior University. Please visit us at med.stanford.edu.